The difference between a midwife and an OBGYN, as a midwife, I'm an advanced practice nurse who's had additional training to deliver babies. So I've been an OB and delivery nurse for several years. So as an advanced practice nurse, we have that additional training. We see women for well women care. We see women for preception counseling, STDs, well women exams, that kind of thing. One question is often, where can I deliver my baby? Can I deliver at home or the hospital or what? So for our care and for Genesis, we deliver only at Genesis. For women who want to have home births, there are midwives who do that. But for our sake, we do just deliver at Genesis. I do encourage women that want to deliver at home that they seek out certified nurse midwives who do that and follow those parameters. Do I use different herbs and do I have special tricks and you know what I mean? No. I follow certain guidelines, I follow certain practices, I follow ACOG guidelines, I follow A1 guidelines. I want my patients to know that I want their delivery experience to be what they want it to be. It's my job to help them to get that experience that they want it to be. But it's also my job to inform them there are parameters that I have to follow, and that's where that informed consent comes into play. So if they want to ambulate, if they want intermittent monitoring, then that's the goal. However, if there is an issue that arises that maybe something happens where they can't have intermittent monitoring, but it's my job to inform them, so they're not surprised if that happens, so they're not disappointed if that comes along. But I want them to have that experience that they want, and hopefully they get that. But sometimes we know that isn't always what happens. But the goal is a healthy mom and a healthy baby, and if that happens, then goal achieved. You can choose both to see an OB provider, physician, and a midwife. And sometimes I think that's the best of both worlds, especially if there's some type of moderate risk factor. Which I think is fabulous. In our case with Dr. Wareham and I, why not? If there's that risk, see me, see him, and then that's the best of both worlds, in my opinion. So it's a great choice. Some women would want possibly a familiar face in case we need to call him, in for delivery, but you could see me from beginning to end and possibly never see a physician. So that's just a personal decision on the patient's behalf. Typically, high-risk mothers do need to have physician care. There's levels of high risk, so like a moderate risk can have midwifery care. We will often co-manage with a physician depending on what that risk factor is. So that is usually on a case-by-case factor. Midwifery services are covered by most insurances. If there's ever questions, then patients can just call their insurance covers and verify. But for the most part, it is covered. So being here in Zanesville is another opportunity for women to come to us for access to care. We consider this, a safe place to receive care, physically, emotionally, socially. The definition of a midwife is that with women. It's the literal term of what a midwife means. So we spend time with women. We spend time with women in labor. We spend time with women in the office. It's about education. It's time spent with women with their families. So we work with women to give them that education that they deserve, that they need. It's so that they have the opportunity to make informed decisions about their care.